Most people think hospital information systems are just digital patient records. That's too shallow. A hospital is one of the most complex organizations in the world. Patients, doctors, nurses, labs, pharmacies, appointments, emergency cases, billing, insurance, medicines, beds, reports, and treatments all need to work together. And if information is delayed, missing, or wrong, the damage is not just financial. It can affect human life. That is why hospital information systems are so important. In simple words, a hospital information system, or HIS, is a complete information system that helps hospitals manage patient care, medical records, appointments, departments, medicines, billing, staff, labs, and decision-making. Think about a patient entering a hospital. First, the patient registers at reception. Their name, age, contact details, medical history, and reason for visit are recorded. Then the doctor checks them. The system stores diagnosis notes. If a test is needed, the lab receives the request. If medicine is prescribed, the pharmacy sees it. If admission is required, the bed management system checks availability. Billing and insurance are updated. Later, management can review patient flow, waiting time, medicine usage, and department performance. To the patient, it looks like a hospital visit. But behind the scenes, many information systems are working together. The first major system is the Electronic Health Record, or EHR. This stores the patient's medical history, diagnosis, allergies, test results, prescriptions, previous visits, treatment notes, and sometimes imaging reports. This is critical because doctors need accurate information before making decisions. If allergy information is missing, the wrong medicine can be dangerous. If old reports are not available, diagnosis can become slower. If treatment history is incomplete, doctors may repeat unnecessary tests. So in healthcare, data quality is not just about efficiency, it is about safety. The second major system is the appointment and patient flow system. Hospitals need to manage patients moving through reception, consultation, testing, pharmacy, discharge, and follow-up. Without a proper system, waiting times increase, departments become crowded, and patients get frustrated. A good hospital information system helps track who is waiting, who has been seen, which doctor is available, which test is pending, and where bottlenecks are happening. The third system is the laboratory information system. When a doctor requests a blood test, urine test, or other lab work, the request goes to the lab. The lab processes the sample, records results, and sends them back to the doctor. If this is done manually, reports can be delayed, misplaced, or attached to the wrong patient. A connected lab system reduces these risks. The fourth system is the pharmacy information system. This manages prescriptions, medicine stock, dosage, expiry dates, drug availability, and sometimes drug interaction warnings. For example, if a doctor prescribes medicine that may conflict with a patient's allergy or current medication, the system can alert the healthcare team. That is how information systems support safer care. The fifth system is billing and insurance management. Hospitals handle consultation fees, tests, procedures, medicines, admissions, insurance claims, refunds, and payment records. If this process is messy, patients face confusion, and hospitals lose money. A hospital information system connects medical activity with billing activity. The sixth system is bed and resource management. Hospitals need to know which beds are available, which rooms are occupied, which patients are waiting for admission, which equipment is being used, and where critical resources are needed. In emergency situations, this becomes extremely important. A hospital with poor information flow can have empty beds in one department while another department struggles blindly. That is not only an operational failure, it is an information systems failure. The seventh system is business intelligence and hospital analytics. Hospital leaders need to see patient volume, waiting times, department performance, medicine usage, infection trends, readmission rates, staff workload, bed occupancy, revenue, and cost patterns. This helps management make better decisions about staffing, equipment, budgets, departments, and patient care quality. But here's the catch. Hospital information systems are powerful, but they are also risky. If the system is slow, doctors waste time. If the data is wrong, patients can be harmed. If privacy is weak, sensitive medical records can be exposed. If staff are not trained, the system gets misused. If departments are not connected, information gets trapped. If the system crashes, hospital operations can suffer immediately. That is the brutal truth. In a hospital, bad information systems do not just create inconvenience, they create danger. Healthcare data is also extremely sensitive. A patient's diagnosis, medicines, mental health history, test results, and personal details must be protected properly. Privacy is not optional here. It is a moral and professional responsibility. This is why cybersecurity is a major part of hospital information systems. Access control matters. A receptionist should not see everything a surgeon can see. A pharmacy may need prescription data, but not every private doctor note. Billing may need charges, but not unnecessary medical details. The right person should access the right information for the right reason. Today, hospital systems are becoming more advanced with AI, cloud computing, telemedicine, remote monitoring, and predictive analytics. AI can help detect patterns in scans, predict patient risk, support diagnosis, reduce paperwork, and summarize medical notes. Telemedicine allows patients to consult doctors remotely. Remote monitoring devices can send patient data from home to healthcare teams. Analytics can help hospitals predict patient flow, medicine demand, and emergency pressure. But again, AI cannot fix a weak hospital system. If patient records are incomplete, AI recommendations become weak. If doctors do not trust the system, adoption fails. If privacy is ignored, patient trust collapses. If workflows are unclear, digital tools only create more confusion. So the foundation still matters. Clean data, clear processes, trained staff, secure access, reliable systems, human judgment. At the Learning Studio, the goal is simple: to understand hospital information systems as one of the most important real-world examples of information systems. Because in hospitals, information does not only support business decisions, it supports human decisions. Every appointment, test result, prescription, diagnosis, admission, discharge, and emergency response depends on information moving correctly. And when hospital information systems work properly, they do not just make hospitals faster. They make healthcare safer, more coordinated, and more human.